Welcome to the American Institute of Healthcare Professionals video on when trauma emerges in counseling. And in this video, we're going to look at how counselors can better address trauma-related issues that are disclosed for the first time in a counseling session, and how to better therapeutically attend to their client with the issue of abuse or trauma in itself. The first reality, though, is admitting that trauma exists. And this is one of the first principles of trauma-informed care, that it does exist, and it's important to identify and to therapeutically face in the counseling session. 70% of the population has experienced some type of trauma. And it's important to understand these events and the particular subjective experiences of all victim survivors and how they experienced it and how it has affected them. In doing so, trauma-informed care specialists, licensed counselors and social workers, and psychiatrists and psychologists alike need to be aware of the various childhood adverse experiences, referred to as ACE, that can exist within the community. Many individuals are carrying trauma with them, whether it's singular, communal, human-made, or nature-made. Trauma can linger and attach itself to an individual when it is unresolved, causing many problems. Obviously, human-caused violence, murder, assault, rape, abuse, trafficking, neglect, war, and genocide can cause the worst trauma. So individuals within those population bases usually have some type of unresolved trauma if it hasn't already been discussed. Because of trauma always lurking below and manifesting itself, we need to be looking in regards to other individuals with their mental and emotional health, their relationship health, their social issues, as well as physical health, because trauma eventually manifests in physical maladies as well. We must remember that someone who has faced trauma might be shattered, but they're not permanently broken. While trauma has negative effects, the resiliency of a person through counseling and healing is possible. Anyone can heal. No one is ever truly permanently broken. So whether it's a child or an adult, there is always a chance to redo, to re-help an individual in regards to when help never existed prior, to open your arms when they were once closed by others to these individuals so that they can begin and actually start the healing process. We must remember, though, that a shattered person is terrified to discuss these issues. But all human beings are in a state of what we refer to as becoming. So that possible change, once that dialogue is breached, becomes a possibility for healing itself. And that's why it's so important to have this discussion. Another problem is that shattered persons are also, though, ashamed. They're not just scared, but they're also ashamed to discuss the trauma. They might have low self-worth and low value. So their self-esteem and their self-actualization of who they are needs to be rediscovered and reinstilled through the counselor. And the counselor in this way can help guide this shattered person and help them again put the pieces back together. And again, that first step is being brave enough and to compliment the client, the survivor, the victim, to be that brave, to come forward and to discuss, because that's the first literal step of healing. Which brings us to counselor qualities to help create the necessary environment to plant the seeds within the victim survivor's mind that it's safe, that it's okay to finally discuss this horrible event that happened in their past. So there are a lot of prerequisites to healing, and establishing a secure and safe environment for an individual who won't fear retribution, that won't fear attack, where someone feels that they're able to discuss everything and not be judged or labeled. This is extremely important. And Carl Rogers emphasized this within some of his Rogerian philosophies on counseling, that the counselor needs to be genuine. The counselor has to be there in the presence of the person, in the present moment, and be sincere in one's attitudes, in one's statements, in one's trustworthiness to come forward and to want to understand who the person is. And this leads to empathy. And empathy is different than sympathy. Sympathy is feeling for a person. And sometimes sympathy can be really bad in counseling. We always as individuals who are suffering, sympathy sometimes can be kind of condescending in some ways, where someone feels sorry for you. Empathy is a little bit different. Empathy is feeling with the patient. It's taking upon the patient's feelings and being within the shoes of the patient or the client or the victim or the survivor and walking with them without judgment, without labeling, without assessing, but just understanding the person and then walking with that person. And empathy is the key, because it is through empathy that therapeutic healing can take place within a victimized, traumatized individual, because the person feels the ability to move forward without judgment, without being labeled, without having their emotions questioned. And this is where unconditional positive regard comes in. Another important quality that is essential to counseling, according to Carl Rogers. And this is accepting the patient without condition. And this can be very difficult. Counselors many times disagree with their clients, maybe not just on what they've done, but their coping strategies. They might be implying that their client is involved in maladaptive coping through drugs, or maybe they're being sexually promiscuous. So we might, as counselors, disagree with a lot of this, but with unconditional positive regard, we're not necessarily condoning. Instead, we are accepting the situation. We're accepting the person as they are at the moment, shattered, but we're going to help them find the light, to help them find it, not through dogmatic lectures that can be demeaning, but through a therapeutic sojourning of walking with the client, walking with the victim slash survivor, and giving them this unconditional positive regard that has a complete and total full acceptance of who they are and what they're doing and where they're going. In addition, Carl Rogers uses the term prizing. We want to prize our client with the needed warmth, love, and patience and encouragement that's necessary. So we're trying to build them up, and it's done with a genuineness. It's not done just to say things that we don't mean. Instead, we are letting the victim, survivor, client understand that there are many genuinely good qualities about them that will help them grow, that will help them heal. And it's through this particular process of genuineness, empathy, and unconditional positive regard that an individual starts to very slowly hear themselves. They become more aware of themselves. And they become more aware not only of what happened, but maybe also of some erroneous thinking patterns, some poor decisions. And in this self-realization, this self-awareness, the counselor helps and walks with the client hand by hand in self-determination of finding the right path. And right is sometimes even a wrong word to utilize here. But it is this self-discovery that is only able, under the fertile field of empathy, that this can occur. Because I think if you really think about it, if you go to a counselor and you're expecting advice, you're expecting directions, and you're expecting this is what you do and not do, and this is right and this is wrong, Sometimes this can create a rebellious attitude. It's good maybe in some fields of study, some sciences, but when it comes to counseling, it is counterproductive because counseling is therapeutic. It's about self-discovery. It's looking for a lasting cure, not just something that a person just decides to do because they were told to do it. So these are the qualities that are necessary when trauma is introduced. Here are some key concepts when discussing it. Instead of what is wrong with you, how about what happened to you? And that's how we need to look at these victims and these survivors in helping them. Again, we spoke about in the beginning how many are afraid to discuss or embarrassed to discuss. So we need to create an atmosphere of trust, an atmosphere of safety and security for them. Many may be discussing this trauma for the first time, but others may be discussing it for the second time. Maybe the first time they brought it up, the story was dismissed. Or maybe they were told they are lying and they were made to feel very bad about themselves. So in this case, the counselors need to show empathy towards them and avoid these labelings and these assessments. Individuals who have gone through trauma don't want to be assessed and given a stat or a number. They want to be seen as a human person itself. And this is why trauma is better discussed, especially if it's more in the past, to be discussed during an initial assessment instead of when a person is in an acute crisis. This is when crisis occurs when someone is, their equilibrium is off tilt and their ability to stabilize and cope is off. So it's kind of hard to go into a therapeutic relationship of dealing with the trauma in its many layers. So individuals in crisis need stabilized, de-escalated. So it's a totally different type of discussion when you go into that. You're going into a different field, you need different tools in this regard. So when we're actually discussing the trauma, it shouldn't be when they're in the actual state of crisis itself. In delving into trauma when appropriate, sometimes it's good to enter from the beginning and the end, pre and post, with the trauma event in the middle. So if we talk about how did you feel before this, okay, and how did it make you feel after, then we can slowly start to go in. It's kind of like jumping into cold water all at once. You know, most of the time it's very shocking if you just jump into ice cold water in a pool. If we slowly get in, we can adjust to the temperature change. So this is the same idea and concept, but being applied to something that is very shocking, but emotionally in itself. Also, it's important when discussing trauma to allow the victim or survivor to dictate what is said. If the survivor and the victim doesn't want to discuss details, don't probe for details. Let's allow it to be the general story itself. The counselor should also be aware of during the telling of these stories for potential triggers themselves, because these triggers can re-traumatize. They can re-traumatize a client or a survivor or a victim. And as the session comes to a close, it's very important to prevent re-traumatizing. And that's one of the key concepts, one of the key 4 R's I spoke about in another video of trauma-informed care. It's helping individuals not be re-traumatized. In addition to that, we should allow the victim or survivor to maintain some control during the treatment. Remember, many victims, survivors, they have no control in the trauma that they experienced. So taking that control away from them can be detrimental itself. And this is important whether we decide to use CBT, exposure therapies, EMDR, or talk therapy. It's good that the counselor and the client work together as a team. And when things are beyond your scope of practice, your professional scope of practice, that you refer them to particular other professionals or services that are better else offered in other places. Of course, with the consent of your client, working with them together. Unfortunately, despite what many trauma survivors and victims might not want, if it is a current case, it must be reported. You are legally obligated to report sexual abuse, abuse itself, and report it to the appropriate authorities. You should temper this subject with the client before they discuss trauma, especially if they're still traumatized to such a level and fearful that much, that they should know that if something criminal is stated in this, it's not confidential. And this is something that should be done in pre-screening, of course. But if it is stated during the session, you are legally regarded to report this. So how do we facilitate better trauma responses themselves within the session and the facility? Here are some more key concepts. We want empathy and no judgment to be within the agency itself. It needs to permeate throughout the entirety of the agency. As mental health care providers, we also need to have a more open mind to merely just pharmaceutical answers and medications, but to be open to other holistic and therapeutic modalities that can be used in sync with more traditional medical and pharmaceutical responses, or maybe just merely replacing as needed. We must also understand the impact of trauma is not just personal sometimes, but many individuals enter into the agency or the counseling seat or chair from different cultural backgrounds that have cultural, religious, historical, sexual, gender biases that they've had to deal with their whole life. And their particular culture, their particular background might have a particular type of trauma associated with themselves in terms of how they view themselves and how they deal with it. Another important thing within agencies is a balance of power and treatment with both counselor and victim survivor. Many times, again, trauma survivors and victims had no control. And when they are controlless, powerless, then that can re-traumatize. So giving them a voice, giving them an ability to speak and to determine the course of action is very, very beneficial and also very therapeutic. This also comes into play with this as well. When you look at long-term facilities, sometimes certain procedures and restraints used on particular individuals may re-traumatize a victim or a survivor. And a lot of times lower staff members are not trained in this, and they don't understand the trauma-induced paranoia that they're causing on a particular individual. Instead of de-escalating, they are actually escalating the situation itself. In that case, also, we need to look at agencies and their staff. Many are underfunded, many staff members are overworked, and many of them are not just counselors who have interactions, but the staff members and workers at hospitals, short-term, long-term facilities. And it's very important that they have an understanding of trauma itself. As for counselors and nurses in the psychiatric fields, obviously burnout is something that can occur not just for them, but for other employees. So it's important from a management perspective to keep an eye on this as well, to ensure that everyone is working at full capacity. Because the moment burnout comes into play, then we start losing what Carl Rogers pointed out. We lose that genuineness. We lose that empathy. We lose that unconditional positive regard because we're burnt out. It's not a human being anymore. It's patient number 3 of the day. I got 5 more to go. It becomes just a process, like a factory. And this is something that can never happen in mental health. So it's so important to watch for the own mental health of our employees, of our counselors, so that vicarious trauma doesn't take an effect. Because a lot of these stories that we hear from these individuals are very dark, and they can break us down and make us doubt humanity and alter our worldviews and our positivity, which is so critical in helping these individuals of trauma to survive. We are AIHCP. We have various behavioral health certifications, also in trauma-informed care. Our link is below. Our number is 330-652-7776, and our email is info@aihcp.org. Below are our resources for today's video. Feel free to check them out as well. I'd like to thank you for listening, and also have a good day.